Michael Serapio is on our top story for us this morning. Michael, good morning. Walk us through the concern that we're now seeing from so many doctors.
John, good morning to you. And absolutely, on this Easter Monday, we're hearing from doctors and emergency room teams as they continue to respond to these latest surges of infections. Many of these cases driven by the variants of concern, in particular the B117 strain that was first detected in the UK and more recently in British Columbia and Alberta, outbreaks tied to the P1 strain that was first detected in Brazil. Now, these variants are making this third wave of COVID-19 very different than the first two, as they are more transmissible. They're attacking younger people harder. And to that, take a listen to Dr. Michael Warner. We heard him right off top, but he is the medical director of critical care at the Michael Garron Hospital in Toronto. Take a listen to a bit more of what he had to say.
This is a new disease. COVID 1.0 was different. The COVID of wave 3, I am scared of. And the patients I have in my ICU right now, many of them are younger than me. And unless we take much more drastic action to cut this off, it's just going to get worse and worse.
And to illustrate that, after a sharp drop in coronavirus cases in this country from the January peak, the numbers are now going back up. In Ontario, there are 796 people in hospital, more than half in intensive care. So bad that doctors may soon have to decide which patient gets care and which do not. In Quebec, there are 501 people in hospital. Alberta has 292 people in hospital. The province now investigating a significant outbreak of the P1 variant. And in British Columbia, there are now 296 people in hospital, with the province sounding the alarm that these variants are leading to more hospitalizations, and again with younger people. So if some might feel untouched, take a listen to what we heard from Anthony Dale, the president and CEO of the Ontario Hospital Association.
This is the biggest crisis in modern Ontario hospital history. At the moment, I have to tell you, it's frightening because there's no end in sight. That is why you see so many physicians in particular panicked over the prospect of what is to come. This virus, if it hasn't touched you yet, it in all probability, before this is over, it will.
And consider this, John, on March the 1st, officials announced just under 2,600 cases, and at last count, that has more than doubled just a month later, and that trend line is just going exponentially up.
Stark warnings, hard numbers, have many doctors calling for a change in strategy. Michael, what can you tell us about that?
Yeah, in particular in Ontario, John, where hospitals are feeling the strain of these new cases. Take a look at these tweets from Dr. Isaac Bogosh, of course, a regular contributor with us, but also infectious diseases expert with Toronto General. And he says locking down does not protect essential workers who, by virtue of being essential, still have to go to work. Let's go to his next tweet. He says, "We know who's getting infected, where they are getting infected, and how they're getting infected. Why not address this directly?" So to build on that, here is what we do know. Locking down, say the experts, only cuts down new cases by about 50%. The other half are essential workers, people who don't have sick days, people who don't feel they can say no to their bosses, and people who are not currently prioritized by vaccines because they are younger. So take a listen to Dr. Zain Chagla as he talks about that.
Socialization is happening, and that's not what's driving this pandemic. It is particularly in these urban areas, 20 to 40-year-olds that are forced to be on the front lines, that are forced to expose to risk so that we have food on our tables, power in our houses, construction, and many of the other things that we take for granted. And unfortunately coming down with COVID-19.
Which is why, John, many doctors now say if officials want to control this third wave, they need to start prioritizing essential workers, targeting a whole new demographic, a younger demographic than the current strategy does, in order to save more lives.